I think we're going to go ahead and get started. I still see our numbers climbing, but hopefully we're going to just kind of start with a couple of things. My name is Jacqueline Hurley. I am the Business Development Manager here at Solutionreach, and I've been with Solutionreach for more than a decade and so excited to host this webinar today. We're going to go through a few little housekeeping notes. The one thing I want you to know for sure is how to ask questions. So all of your microphones will be muted. So if you have any questions for the presenters, please type them in the question box. It's in your GoToWebinar control panel. We will try and answer as many of your questions as we can when we go through our Q&A session after the presentation. Also, if you're having technical difficulties, you can ask for help in that same box. We will have a member of our team respond directly. One common thing is that if you're having difficulty with sound, please try calling in for the audio using the information that was included in your webinar information. If you find yourself frantically trying to take notes, just know you will receive the slides to this presentation as well as the recording. We are offering 1 CE credit if you are from the dental community, and we'll announce the CE code live at the end of the presentation immediately following the question and answer session. Unfortunately, we are not able to share the CE code after the webinar, so please make sure you are watching and listening so you will have the correct information for your CE credit. We are very active on social media right now. It's a great time to connect with us on Facebook, Twitter, and LinkedIn. We are wherever you are on any of those platforms. Also, if you are a Solutionreach client and you would like have some support questions, and our client success team would be happy to assist you, just go to community.solutionreach.com, click on my support, or you can email community@solutionreach.com. I would like to introduce to you both of our presenters today, starting with Sam Christensen. We're super excited to have Sam joining us. He comes from Premier Diagnostics. Sam is here to help us understand more about COVID-19. Premier Diagnostics is a testing center and has helped thousands of people know for sure if they have COVID or not. And then I also want to introduce to you Lori Boyer. She is the manager of our brand and campaigns here at Solutionreach. She has spent 10+ years researching and developing best practices for healthcare organization. She's written and published hundreds of white papers, guides, checklists, ebooks, and more on practice management. She manages a healthcare blog with over 24,000 subscribers. Be sure to check it out. You can find it on the Solutionreach site. She hosts educational video series teaching practices how to manage their office. So Lori, I know everyone has a lot of questions today. We're here to learn more about the COVID-19 vaccine, and I'm going to turn the time over to you.
Awesome. Let me go ahead and show my screen. Okay, hopefully everybody can see the agenda. I am super excited, everybody, to get into this topic. Again, I do know some people have been having some audio issues. Please make sure if you are having any issues hearing that you can just jump on your phone. That sometimes will fix the problem. So make sure you do that. Sam, I also wanted to give you a chance to say hi.
Hi, everybody. Glad to be here with you today.
So I invited Sam in, and he's just going to talk to us a little bit about the potential you guys have to offer the COVID-19 test in your practice. And he's going to pop in later for us, but I am really excited about having him here. So today we are going to talk about the latest vaccine information. We're going to be starting by simply diving into kind of what the vaccine means for you personally. And then we're going to talk about how it has to do with the vaccine and your practice, administering the vaccine or COVID-19 tests, and any questions. So then we'll open it up for all your Q&A. So throughout the entire session, go ahead and just put your questions into the little question box, okay? And we are going to move on to the latest vaccine information. So a lot of this you guys are already going to know, but I think that it's important to cover. Currently in the US, there are 2 vaccines that are available. we have the Pfizer and the Moderna. I'm sure you've heard of both of them, but here are a little bit of the stats specifically on those. They're both right around 95% effective, 94% for Moderna, 95% for Pfizer, but it's really similar. For both of them, you're going to get a shot in the upper arm. Both of them right now require 2 shots. Pfizer, they asked that they're 21 days apart. Moderna asked that they are 28 days apart. One interesting thing is that these are mainly for adults at this point. So the Pfizer, 16 and up can get it. Moderna is only 18 and up. Now, this being said, there are a bunch of vaccines in development right now and will probably move forward in the near future. So I think that keep your eyes open, things are going to change, but right now this is what we have. And I do know actually in terms of like the 2 shots, there is one that's fairly close that is a single shot as well. So that's going to change. Safety, that's something that we get lots of questions about. How safe is this? It was done super fast. What are we supposed to trust this? And so first thing I want you to know is that no safety measures were skipped during the process of going through this. So all of the things that the FDA lays out were all conducted. They just did them simultaneously. So they took place, they kind of overlapped, or sometimes they would just do 2 exactly at the same time. They also actually expanded a bunch of their safety protocols since they were doing it so fast. There's something they have called Be Safe, which they're following up with health checking as people are getting vaccinated. So as millions more people now have experienced the vaccine, they're continuing to gather that information and try to understand potential side effects and long-term problems, all of that kind of stuff. So safety protocols have taken place. We've had tens of thousands of people who were tested with the vaccine, both vaccines, and they were approved. One thing I do want, it's important to say, this is a very common question or confusion. You cannot get COVID-19 from the vaccine. This current vaccine does not have a live virus in any way. The mRNA vaccine does not carry a live virus. You cannot get COVID-19 from the vaccine. So that is something to be aware of and not to be afraid of. Next, are there times when you should not get the vaccine? That answer is yes. If you in the past have had a severe reaction or an immediate allergic reaction, regardless of how severe it was, to any of the ingredients in the vaccine, you shouldn't get it. Okay, so a severe reaction is anaphylaxis. Is that how I say it? You would know if you've had a severe reaction. Or an immediate reaction is hives, swelling, or wheezing within 4 hours of coming into contact or getting a vaccine or something else, any of the ingredients in it. So I have listed, as Jacqueline mentioned, you're going to get a copy of all these slides and you'll see some links throughout. I've included links to all of the ingredients listed in Pfizer and Moderna so that if you are a person who's had some allergic reactions in the past, you can check that link and list of ingredients to know whether or not, there was a lot of common allergy things, food, insect allergies if you're allergic to bees, latex, other allergies like seasonal allergies, those are not an issue. So that's not what we're talking about here. We're talking about some really specific things inside of these vaccines. Now, we also get a lot of questions about pregnant and nursing mothers. So pregnant and nursing mothers were not included intentionally in the original studies. However, there were multiple women who became pregnant during the study. And so this is something, here's would be my advice. Talk to your OBGYN. See if with your individual personal health conditions, if they feel like that's right for you. It is approved and it's fine according to the FDA. They say you're good to go, but I do think it's something that you may want to talk about. However, keep in mind that being pregnant is also one of those high-risk conditions, actually puts you at risk of having a more severe case of COVID-19. So it may be safer for you to get the vaccine than to get COVID. So I would just check with your OBGYN. So when can you expect to get the vaccine? I'm betting a bunch of you already have. I am excited and can't wait till I can get it, but you guys are ahead of me in line and absolutely should be. So I just want to say that the way that the vaccine program has rolled out initially has been very state driven. So every state has had kind of complete control over how they're rolling out their vaccine. Now, with yesterday's inauguration with President Biden, there's some good chances that's going to change. And what's happening is he's creating kind of a big initiative to roll out more vaccines and a lot faster. We're at a very slow pace right now. At the pace we were at a few weeks ago, it would have taken 10 years to get everybody vaccinated. So the federal government is hoping to step in and have a little bit of more of a role. So that may play out as we go forward. But as of today, it's going to be by your state. However, in the federal plan, healthcare workers are advised to be in phase 1, and that includes every specialty of healthcare. So that includes dental, vision, podiatry, whatever you are included in that healthcare workers. That even includes, my mom is a counselor, like psychologist, all of that. That's included as a healthcare worker. One thing that I hear a lot is, are we talking just our doctors? Are we talking our nurses? Are we talking clinicians? And that is not. So when you're eligible to get the vaccine, every person who works in your office is now eligible. The front desk person, anybody, okay? And so again, now is probably the time that you should be expecting. I would hope that most of you are at a stage where you can hopefully get it soon. I was able to get a list specifically where it's currently laid out by state for the dental industry. So when you get these slides, you can click that link if you're in the dental industry and go ahead and see where your state lies. Now, if you do become eligible, how are you going to know that it's your turn, right? This is, again, it's going to vary a little bit by state. But typically what the goal is that your local health department will actually notify you or will send out notifications saying, hey, it is time for you and your specialty to be able to get vaccines, and we'll let you know how to do it. In addition, if you have local healthcare associations, so let's say you're an optometrist and you have an optometry association in your state, they should hopefully be conducting outreach. That being said, things are crazy with people trying to get all of these vaccines rolled out. And I think there's a good chance that you would get missed in notifications. So keep your eye on the news. That's a good place to look. And also just check in with your state regularly and go to their website. You could look, I would look for even for your own county because each county, so here in Utah, where we are, I know that different counties are rolling things out. While it's the same group for the state, the way they're doing it is slightly different. So, look at your county health department website and that should help you know. Okay, let's talk side effects, everyone's favorite and least favorite topic when it comes to vaccines. A couple of things, I have a little chart here and we're gonna go over it, but typically these side effects are going to start within the first couple of days after you get the vaccine, and they should only last a few days. So we're not talking like a 2-week illness. Something really important to note, especially as many of you may have your first shot but not your second shot, side effects are a lot more common after the second dose, and they're usually more stronger. They're usually more severe. So keep that in mind when you're getting your second dose. In fact, the CDC has recommended that when your staff is getting vaccinated, that you actually stagger. So don't have let's have a big staff party and everyone in our staff go get vaccinated at the same time, because you have the potential that everybody in your staff might not feel well and need to call in for a day or so. So to avoid staffing problems, the CDC recommends staggering your staff vaccinations, which I think makes a lot of sense. So you can see over here, here are the side effects that took place during the studies for Pfizer and Moderna. Pretty much everyone gets a little bit of an injection site reaction. That's the pain in your arm where the shot actually happened. However, it's highly likely you're also going to have fatigue and headache. Moderna has more. So this is something that's interesting to see. More people with the Moderna vaccine have side effects. So they typically have muscle pain and joint pain and chills. That's lower in the Pfizer side. both sides were about the same in terms of fever. 14 to 15% of people will get a fever. And, side effects, I know a few people. I talked to a nurse recently, and she was sharing that she thought it was great after her first vaccine. Her second vaccine, she did end up with a fever and fatigue and needed to take a couple of days off. I think that is kind of common, and it means the vaccine's working. So when you do feel kind of crappy for a few days after, it will pass, and it's not fun, but know that those are the signs that the vaccine's actually working in you. Okay. Now, we get into a whole other realm of questions here once you get the vaccine. If you get COVID-19 symptoms, so let's say on a Monday you go in, you get your vaccine, Tuesday you start to feel bad. Now, obviously, the vaccine can give you COVID-19 symptoms, right? The fever, fatigue, muscle ache, all of those are COVID-19 symptoms. So, do you need to quarantine? That's the question. Should you not be going to work? This is how the standards that they've set out. If you have a fever, stay home, just to be extra careful. However, if you have no fever, if you feel generally well enough, if you only have symptoms that are related to the vaccine that are not COVID-19 symptoms, if you've not been exposed to anyone, so if you were exposed to someone, you obviously need to quarantine. And if you you wear your full PPE and everything, you may continue to work. One of the things I want to point out is cough, shortness of breath, sore throat, loss of taste and smell, that famous one we all know, those do not occur as side effects of the vaccine. So if you start getting those symptoms, it's more likely COVID. And you probably should get a test and whatnot, but definitely you need to quarantine. So typically, in terms of reactions, if you have a fever, yes. Otherwise, no, you're okay to continue working. That being said, if you really don't feel well enough, again, we've talked about the fact that a lot of people really feel kind of yucky for a day or so, then of course, stay home, rest up, do the things that you need in that terms. So what if you've already had COVID-19? Unfortunately, in the healthcare industry, you guys have been exposed a lot, and I know a lot of you have had COVID-19. Do you still need to be vaccinated? The answer to that is yes. And this is because it's unknown how long your natural immunity is going to last. Currently, we know it'll last at least 90 days. And it's likely longer. And in terms of like natural immunity after you get the disease, after you get COVID-19, it completely seems to vary based on your age, based on your immune system. All kinds of factors play into that. However, eventually that immunity will run out. I do know of 3 different people who have now had it twice. Interestingly, 2 of them, they had it the first time, it was more severe, and the second time it was more mild. The third person, though, was far more severe the second time they had it and was hospitalized. So we're not on a clean break that if you had a case and you get it again, that it's going to be less severe, unfortunately. One interesting thing to note in terms of vaccines here, the government is asking that if you are eligible to get your vaccine, so let's say that you're working in a pediatrician's office and they say, yep, it's your turn to get the vaccine. The government's asking that if you've had COVID-19 in the last 90 days, that you wait to get your vaccine until 90 days are up. I want to make this clear. The vaccine won't hurt you. It's not going to have some sort of negative side effects or problems if you get it in those 90 days. The reason they're asking is that we know you have some immunity for those 90 days. So they would like to get the vaccine out to more people who do not have any immunity. So that's why they're asking for that 90 days. It's not just because you would have any bad side effects. Okay, so this brings us to our first poll. I'm super curious where we are in terms of vaccinations. And so Jacqueline, can you bring up our poll? And this is obviously just anonymous. We won't have your name or anything. So you can just put in, have you gotten both shots? Have you not had any? Or have you just had the first shot? And I'll give you just a minute to look into that. I'm going to give us, let's see where we're at in the poll. See how many people have answered it. Okay, I think we're good. Let's go ahead and close the poll, show our results. All right, so it is looking like the majority of you have not had any, either of your vaccines yet. Okay, oh, and 2% of you, 2% lucky people have had both shots, and 34% of you, which is kind of what I expected, have had that first shot and haven't had the second shot yet. So interesting, that's good to know where you stand. I'm super happy that you guys are getting vaccinated. That makes me very happy. Let's jump into, though, talking about the vaccine as it relates to your practice. Remembering any vaccine questions you have, please go ahead and ask them in the questions as we go. We can get to them at the end, okay? Okay, this is one of the questions I've gotten a lot. Can you require that your staff get vaccinated? And the answer to that is actually yes. In December, on December 16th, the Equal Employment Opportunity Commission made the decision that employers are allowed to require employees to get vaccinated before entering the workspace in terms of creating a safe environment for you. However, there are some caveats, and I want you to, as with anything, there are ways to get exemptions for this. So employees that either have a disability, and I would think for COVID, a lot of times those disabilities may mean things like where we talked about, you have allergic reactions, you can't get a vaccine, or any other physical reason that your doctor says it's not okay for you to get vaccines, whatever it is. Or if they have a sincerely held religious belief that prevents them from getting inoculated. Those people are exempt and can request accommodation through the ADA. The Disabilities Act, the American Disabilities Act. What that means in terms of accommodation is they would have to work from home, basically, or work when there's nobody at the workplace. If you decide to create a policy requiring vaccination. However, there are some rules in there that if they have a job that they literally cannot complete from home, then there are some options for you to then let that employee go. However, I would totally recommend if you're getting to the point where you're going to let an employee go because they don't want the vaccine, I would definitely check with your lawyer and just make sure you've dotted all your I's and crossed all your T's and made sure that you're following their exemptions correctly. Now the question, should you require the vaccine? That's a whole other can of worms. And I think it's going to be a personal decision for you. I think obviously, ideally, you don't need to require it. You can encourage your staff and they can go in and you can all get vaccinated and you don't have problems. Now, generally, I would try to work with people who don't want to get it, rather than creating a really toxic environment. However, if you do have, say, an employee who kind of is very reckless in terms of their precautions, they're not good at then wearing their PPE. I know I've talked to, in fact, I recently talked to I can't even say it, an eye doctor who was really struggling with some of their techs wearing masks and stuff appropriately. So let's say you have a person like that and they tend to not follow safety guidelines well, and they refuse to get vaccinated. It could be that you want to make a policy that would help you get around that. So that's something that's going to be up to you, but generally, yes, legally you can. So what about your safety protocols then in the office? Once you guys, let's say your entire office is vaccinated, woohoo! What then? Do you get to stop wearing all this PPE? Can you stop wearing your masks? Can you go back a little bit to normal? Sadly, the answer is no. As of now, all of the safety precautions you're taking have to remain the same, even after you get vaccinated. Why? Well, this is because with the current vaccinations we have, the Pfizer and the Moderna, you can spread COVID-19. Okay, so this was a little confusing to some people at first. They said, how could I spread it? But I'm going to give you a really basic Lori Boyer non-doctor version, a dumbed down version for Lori on how this works. So when we get vaccinated, it's kind of an internal deep muscle type thing with these shots. However, let's say you're out there vaccinated and you come into contact with someone with COVID, you breathe it in, and suddenly in your nose and mouth and throat, you've got these little bits of virus hanging around. Okay, if they get deeper into your system, your vaccine, your immune system's going to just fight them off because you're protected. However, if you sneeze or breathe or cough or laugh or sing or whatever, and those virus particles come out at the person, you have now spread it. So you can be what's called a silent spreader, like you can kind of carry it around and still give it to people. Next gen vaccines, there's one I know in testing right now, is a nasal one that would give us the immunity in the nose and the throat, the ear, nose, throat stuff, in addition to deeply internal. That would keep us from spreading it. And that would be, so let's say that vaccine comes out, that's going to help us get more close to normal. The other way that we get back to not having a lot of these safety protocols is herd immunity. Now, there's a lot of different numbers I've seen in studies here, but typically we need about 70 to 90% of the United States to get vaccinated to reach herd immunity. I've seen numbers as low as 60%, and I think it always varies a little bit from different diseases, but 70 to 90%. This is one of the reasons it's super important for you to get vaccinated, for your staff to get vaccinated, and for you to encourage and dispel fears for your patients to get vaccinated. The only way we're going to get back to normal is by getting enough people safe and get vaccinated that we're going to be able to protect the rest of the people. I've heard people say, well, you know, should we just wait, and once enough people get the illness, then we'll get herd immunity? Here's the thing. Herd immunity has actually never been achieved through the natural disease process. Think about it like polio or measles, mumps, even the plague. We never became immune to those, even though they were around for hundreds of years. It wasn't until we got the vaccines to stop it. And it's, again, some of that has to do with the fact that we do lose our immunity, and it's different from who's had it, people, yeah. So basically the only real way to achieve herd immunity is through vaccination. So that is why, and that's the way we can hopefully get back to normal. And I can go travel because I miss traveling. Anyone else miss traveling like me? Okay, more questions. We got to keep moving. When you're exposed to COVID-19 after you get the vaccine, then what? Okay, so you've had shot number 1. Your husband comes home, has COVID-19. You have to act as, basically after the first shot, you're still susceptible to getting sick at any time. Okay, you have some protection. I think it's about 50%, depending on which shot you get. However, you still are potentially susceptible. So obviously after shot 1, yes, for sure, you treat it just like any other time. After your second shot, this varies a little bit by state. But if you're 2 weeks past your second shot, the CDC is still asking us to quarantine. And that goes back to the fact that we can spread it. So you could walk around and share what your husband gave you with other people. Now, however, I have seen some states, I think it was New Hampshire, if any of my New Hampshire peeps are here, you could look it up. They changed their guidelines so that you don't need to quarantine if you've been 2 weeks past. So it's gonna, again, states may vary a little bit, but the official guidance from the CDC is that you should still quarantine for the safest measure. All right, so this is another question that I've heard multiple times. What should you be communicating with your patients about the vaccine? What is your role, especially if, say, you're a dentist, or say you're, you know, any specialty that is not directly related to, you know, general well-being. First, I want to say, obviously, if you are primary care, if you're a pediatrician, if you are somebody who's going to be dealing with general health, you're going to want to be sending a lot of information. When they can get the shot, where they can get the shot, how they're going to do it, side effects, potential, all of that kind of information. Gear up. This is what one of the big things I want you to come away from today's webinar with is that you need to prep for when the general public gets the vaccine. Okay, there's some conflicting times, and again, it's different by state. However, anywhere as early as April and as late as June, we'll start rolling out the vaccine to the general public. At that point is when you guys are going to have to kick into gear. And so especially though, if you're primary care pediatrician. However, that being said, it is fantastic best practice for any specialty to reach out and let their patients know that they are eligible to receive the vaccine. So if it goes to the general public and you are, say we were talking about being a dentist, you're a dentist, if you give, send out just a message to all of your patients and say, hey, we wanted to let you know that here in Colorado, the general public is now now has the option of getting a vaccine. That does so much to build that relationship between you and the patient. I have had a few different practices who have shared when they kind of give out general tips and information like that, who say their patients were so touched and so kind of like that you were concerned about their overall health, and even if it didn't have to do with you. So absolutely, I recommend when the vaccine is available in your community, share it. I don't care if you're an optometrist, I don't care what you are, just send out a text message, let them know, hey, you can get the vaccine, and maybe some advice on like, go contact your general practitioner, or you could talk to the health department or whatever it is. But in addition to that kind of information, you're going to have to talk a lot to patients about safety protocol changes, and specifically the fact that they're not changing. So I can see happening is patients coming in and they're saying, I'm vaccinated. Why do you want me to wear a mask? I'm vaccinated. Why do I have to stand 6 feet away from people? It is very unclear to patients right now that being vaccinated doesn't mean you can't spread it. So you're going to need to make that really clear to your patients, and even ahead of time. So you may want to start prepping in newsletters and stuff now, saying, hey, we're excited that some of our patients are getting vaccinated. We are so thrilled for this change. We do want to let you know that you can still be a silent spreader. So we ask you to still wear your mask and social distance and all those kind of things. So make sure that you've got that screening as well. You're going to have to continue to screen. There are that small percent who can still get it. So if you're in that unlucky 5%, for instance, who can still get COVID-19, so you still need to screen your patients. So I'd include this in kind of your pre-visit instructions, your newsletters. And then one thing I say is, everyone, you need to be super prepared for questions. Try to get everyone in your office on board so that they understand any questions. The general public is going to look to you. Even if you are a different specialty, they know that you are in the healthcare field. They are going to have questions about safety and all of those things, but they may also, since you got vaccinated before them, may want to hear about what it was like. Remembering, of course, you absolutely have the right to not need to share that under HIPAA. However, if you want to, you are absolutely welcome to. So if you want to say, you know what, I got it. It was a little uncomfortable for a few days, but I feel great. You know, that's going to help dispel fears and help people moving through this. I thought this was interesting. A person I talked to at one office, they were having a problem because a patient came in so mad and said, I want proof that every one of your staff has been vaccinated, and I am not returning and my family's not coming until you can prove to me that everyone's vaccinated. And I thought that was so silly, first of all. However, if you do start getting patients asking if you're vaccinated, remember, you can see that's a sign that that patient didn't understand that even though you're vaccinated, you could still spread it to them. However, it may make them feel a little bit safer knowing that you were vaccinated. So if they ask, if you want to share that information, you guys should be so proud of me. I actually even checked with our attorney on this. If you want to share your information that you've been vaccinated, and if every staff member is okay with sharing, you absolutely are welcome to. Under HIPAA, you control your PHI. So if you want to share that data, you absolutely can. So if everyone in your office is like, yeah, tell them we did it, you could put that in a newsletter. You could put, we've been vaccinated, we're so thrilled, and whatever. If you don't, or if you haven't gotten permission from everyone in your office, or if you haven't gotten vaccinated and you don't really want that known, you just say something like, due to privacy laws, that's not information I can share. However, I want you to know we really do take safety so seriously, and then talk about kind of some of the things you're doing to ensure their safety and make sure that they're not at risk when they come into your practice. Now, what if your patient got vaccinated? So we talked a minute ago about if you were vaccinated and then end up with some symptoms, what are you supposed to do in terms of like coming to work and quarantining? Similarly, you may have a patient who just got vaccinated, and when you screen them, they may then have symptoms of COVID-19. So, like I said, vaccine symptoms are similar. What the CDC is asking is if they are not an emergency patient, if you ask them if they are in the process of getting vaccinated and they have some symptoms of COVID-19, that you defer treatment until 2 weeks after the second dose. If, however, it's an emergency and they really need to be seen, you need to treat the patient as if they might have COVID-19 and go ahead and implement any of those processes you have for treating a patient who may have COVID-19. Because even though they may have been vaccinated, until 2 weeks after the second dose, you can still get COVID-19 quite easily. And even after that, there's that small percentage you still can. Okay, so this is where I'm going to bring in Sam for a minute. One thing that some of you may be aware of, some of you may not, is the fact that administering COVID-19 tests and the COVID-19 vaccine may be something that you could be interested in and could help boost revenue. I know that we've struggled with revenue over the last year. And so we're going to talk about that. But first, I am going to let Sam explain. Sam works for a company that's what they do. They administer COVID-19 testing, and they also work with healthcare practices to let them administer it. So Sam's going to kind of walk us through some of this and help us understand what it would mean if, say, you as an optometrist decided you want to conduct COVID-19 testing in your practice. Sam, are you there?
Yeah, I'm here. Thanks, Lori. Yeah, well, I'm happy to be with you guys today, and I'm just happy to share some of this information about testing with you. I'm as excited as anybody that we finally have functioning and effective vaccines. But like Lori mentioned, as we've all kind of seen lately, rolling the vaccine out to 300+ million people has been a huge logistical challenge, and we understand that it's going to take a little bit of time. And so while we wait for the vaccine to be rolled out, regular COVID-19 testing is still an effective way to limit the spread of the coronavirus and keep patients and staff safe. So even sometimes people who have been vaccinated will still need to test and register negative tests. There's a policy going into effect on the 26th for travel. Anyone entering the United States has to register a negative COVID test 3 days before their return flight. And if they don't, they can't get back on the plane. So there would be a lot of cases where testing is still kind of an essential thing that we have to do, like work or travel. And as far as testing goes, PCR tests, our DNA amplification tests, they are kind of what's known as the gold standard of tests in the industry. They're highly accurate. They're about 98.9% accurate. And when you need a test, they're usually the best way to get one. So as you guys are medical and dental practices, and Laura, you can go to the next slide there. As medical or dental practice, you might consider offering PCR tests and antibody tests in your office as a service to your patients. Doing this helps keep not only your patients healthy, but also your staff healthy and safe. It also gives patients valuable information and insight into their own individual health profile and how that might influence their behavioral decisions going forward. So, for example, a person who takes an antibody test and registers that they have immunity or have some antibodies is going to be better aware of their health history and how much natural protection or natural immunity they might have at that time. Lori mentioned before that immunity tends to taper off, and this chart shows the different types of immunity, the IgG or the IgM antibodies, and which tests pick up at what point you are in the viral infection and the recovery. So they're really useful and valuable for not only your patients, or not only for your staff and your doctors, but for your patients as well. Finally, this is offering testing services is a channel for you to increase and generate some additional revenue for your practice. Next slide, Lori. So the process, I won't go into detail here, so we'll keep it short for you guys, but the process for ordering and administering the saliva PCR and antibody test is shown below on this slide below. And more information can be provided to people who are interested in learning more. The primary difference between these two tests is that antibody tests can be processed and return results in the office within about 10 minutes. these results are informative, not diagnostic. The CDC has made it very clear that antibody tests are not to be used for diagnostic purposes, but rather for informative purposes, like I mentioned before, showing, giving a greater context to where you are in your health battle against the virus. Saliva PCR tests, on the other hand, are diagnostic, but must be sent to a lab for processing. So this results in about a 24 to 48 hour turnaround time. So that's useful to know as people are quarantining and waiting for their results. But when the results come back, as I mentioned before, they're highly, highly accurate with the PCR test. So there's just some options for you to meet the needs of yourself and your staff and your patients. So we just wanted to make you aware of all of those.
And Sam, my understanding is that any practice can conduct these tests, right? They don't have to have a special license or anything.
Right, I believe so, especially for our saliva tests. The saliva testing, it was approved a little bit later than the nasopharyngeal swabs that first came out. It's a lot easier to administer. It requires less PPE. And so, yeah, I believe that any licensed medical practitioner is able to administer these tests in their office.
Yeah. So this is something that I've had questions, especially as we're going about, you know, trying to recoup revenue and stuff lost in 2020. They're really great because they don't really have to cost the patient. And then you can bill their insurance. And I think if their insurance doesn't cover it, then the government will cover tests as well. And Sam, you can correct me if I'm wrong there, but it's a great way to be able to just generate a little bit more revenue and keep everybody safer. And so I think it's an awesome option for people. So that's something some of you may not be aware of, and I wanted to make sure you knew about it. Thank you so much, Sam.
You're welcome.
I also wanted to talk here a little bit about actually offering the vaccine, okay? Currently, there are limitations on who can offer the vaccine. However, there are pushes throughout the nation to add specialties like dentists, optometrists, other specialties who don't normally do that, as being people to roll out the vaccine. I think with yesterday's inauguration, President Biden is rolling out a lot of new money and trying to create systems to get the vaccine faster. And in order to do that, they are looking for any provider type who might be able to be eligible. In fact, the HHS recently asked states to assess provider types that could administer the immunization and consider expansions, including mass immunizations. And so I know that there's legislation in multiple states trying to open up the ability for practices like dentists to administer the vaccine. And this is something I think that we are going to see closely as we move. Again, that target date is that when the vaccine's going to the mass public. I think there's a likely chance that a lot of places are going to open up that option. That is going to be an opportunity for you to help our healthcare, help fight in this pandemic, and also make additional revenue really easily, because it does not cost the people anything to get vaccinated. So I ask you to think about it and to prep now for that potential. Oregon and California have already passed laws, and they're, at least for dentists, they are eligible to administer vaccines there. So if you're in Oregon or California, absolutely, you need to start kind of gearing up towards that idea of when you might be able to offer the vaccine. So I would love to know if this is something you guys are interested in, if this is something that you're considering. Would you want to administer the COVID vaccine or COVID tests? So let's just do a quick poll. I want to make sure we get time to have lots of questions answered. And Jacqueline, are you getting that poll for us? Perfect. All right, great. I'm going to let about 15% more of us vote. All right, let's go ahead and close the poll there, Jacqueline. And So it looks like the majority of you, so a quarter of you are yes, both if you can. 27% are maybe. Maybe this is the first you've even heard of it. So, absolutely look into it. And some of you are no, probably not. That's awesome, totally fine. It's just something that I think, especially in terms of revenue, you guys may want to look at as you move into the future. Okay, finally, before we jump into your questions, I want to talk about preparing. Okay, so in my mind, there's kind of this like date in the future where suddenly you may be inundated with a lot of communication you need to share. So let's imagine that suddenly it's May 7th and you live in Tennessee, and they have now said the general population can get the vaccine. Okay. Number one, if you've decided to be a part of administering the vaccine, you're going to need a lot of communication. If you're not a part of administering the vaccine, you still are going to need to be sharing information. Like I said, please send out messages regardless of your specialty, letting people know they can be vaccinated, trying to dispel myths and fears, trying to help them get on board. But I know, and I won't name names or anything, but I've spoken with a few major hospitals and health systems who, when they just started trying to roll it out to their employees and to, the first round of people, have really run into some hiccups. And it was mostly all in things like communication, scheduling, trying to figure out how to do the vaccine while at the same time run appointments and all of those kind of things. So I feel like we have kind of this special window before the general public is going to get the vaccine where you can really dive in and start to prepare for when that's going to happen. Prepare for questions. Try to think, perhaps write down every question that somebody might have for you when they come in. Decide as a staff if you're going to share that you've all been vaccinated. Decide if you want to share your vaccination stories. Decide, put together maybe an FAQ sheet on vaccine safety or something like that. I just so ask you, it's going to make your life so much easier if you prepare now, so that then when in a few months you're like, I got this, I'm ready to roll out. So newsletters, I would say create a schedule and write your messaging now. The schedule would be day one. On day one, when vaccines are available to the general public, that would be your first newsletter. And then maybe a month later, you're going to have follow-up info and so on. Write them now. Get that information. Think about what you're going to want to send. Text messages. Please check your system abilities. This is where I saw a lot of people running into challenges that maybe they had a maximum on how many text messages they could send a day, or they didn't have the ability to get people in their schedule, or whatever it is. So please look into your system abilities, plan which messages you're going to send now, and so you can just roll them out when it happens. Think about your reminders. Think about your pre-visit instructions. How are you going to adjust your messaging so that when people are coming in and they've been vaccinated or they're partially vaccinated, that you're covering all of those questions and that you have the answer. In fact, it could be a great idea to put a little cheat sheet of potential questions and answers next to the front desk where you can get all of that kind of information. Signage in your practice. Just create a plan. Decide if you're going to put any information up in the office. Intake forms, things like that. What changes are you going to need? I'm just saying, do it now, and don't experience like what I was saying about, in Utah, I know there was a system completely crashed, and there've been people trying to wait in line, and we only have the people over age 70 and like healthcare workers and teachers. Those people are eligible here in Utah, but they're still crashing the systems trying to get this rolling out. So be prepared ahead of time. I'm going to skip our last poll because I want to get to our Q&A. I know we have a lot of questions and I want to answer as many as we can. Let me tell you what I'm going to do in terms of Q&A, because there are a lot of questions. I'm going to answer as many as I can. As we get close to the top of the hour, I'm going to share the CE credit slide, or Jacqueline probably will for you. We'll talk to you a little bit about what you can do with Solutionreach and with Premier Diagnostics. And then for anybody who wants to stay, we can go ahead and I can answer more questions after. But I want to make sure people who need to get off the call are able to in time. All right, Jacqueline, are you there?
I'm here, Lori. Great presentation. We have lots and lots of questions. Let's start with this one. What would a COVID-19 test show after one has been vaccinated?
Oh, that's a great question. My husband actually just asked me this yesterday. So let's say you're fully vaccinated and you think you might be sick, so you go and get a COVID-19 test. It will show negative if you don't have COVID-19. COVID-19 tests only show positive if you actually have COVID-19. The vaccination will not impact that. So you can feel confident if you get a COVID-19 test after you're vaccinated and it's positive, you do actually have COVID-19. Remember, sadly, there are a small percentage who can still get COVID-19 after the vaccine. However, the good news with that is that they are likely to have a much milder case. So even if you still are in that poor unlucky 5%, it shouldn't be too bad. All right, what else do we got?
What is the longest time frame I can go before receiving my second vaccine? I know it can't be inside 21 days. This person received the Pfizer vaccine and now they've run out. If it's longer than 3 weeks before she gets her second shot, will it still be effective?
Okay, great question. And this is something that a lot of people are facing because we are trying to roll it out. Maybe you get your first vaccine and you can't get the second one in that time frame. It's okay. So don't stress about it. Let's say you wait 5 weeks, 6 weeks, 2 months, whatever. It's still going to give you the protection. You'll still get the full vaccination effect, even if there is that gap. So don't stress out about that. That's fine. I won't get into it. We don't have time. There's a really interesting study about how one of the concerns with having people just get their first vaccine and then waiting a long time is like the virus can then mutate into stronger viruses. But that's like a whole other topic. That's me geeking out on my nerdiness. So yes, the answer is you are fine. Don't worry if you end up needing to wait longer to get the second vaccine. Just don't neglect actually getting it. Okay.
So the next one is, my staff is most fearful of the unknown with the possible long-term effects that with wanting to have children. What studies are out there that I could use to ease their minds?
Okay, this is actually a widespread misconception that started on social media. As always, doesn't everything start on social media? This is not a true issue. In fact, it became so widespread, the FDA actually included it on their FAQs. So if you want to go, you could show them from the FDA in their FAQs. It talks about this. But generally, there is no scientific evidence in any way that indicates the vaccine would cause infertility. It is actually one of the pieces that sometimes people say is that the protein they use is the protein from the formation of a placenta. That's not true. That's not the protein that's used. This is even COVID-19 itself does not cause infertility. And this is a very mild kind of version of simulating those COVID-19 symptoms. So that's also not going to give you infertility. There is no evidence that this happens. In addition, they have tested it in animals. It did not impact animal infertility, which obviously animals get pregnant a lot faster than humans. And it did not impact infertility in any way. So just let them know that this is not a legitimate concern. You can take them to the FDA website. There's information on there all about it.
So in addition to that question, can you get vaccinated while pregnant or breastfeeding?
Yeah, so I talked a little bit about that earlier, but what the FDA, as they said, they didn't purposefully test like pregnant and nursing women. They only tested specific audiences, and just like they didn't test children yet. Doesn't mean that there's a problem with it. They just wanted to do it as fast as they could for the general public. However, there were multiple women who became pregnant during the process and had no issues. Generally, however, when there hasn't been testing yet, that's when it's going to be kind of a decision that you'll need to make with you and your OBGYN. But the FDA does say that they believe the vaccine is completely safe for pregnant and nursing women.
So do you think the antibodies are passed on to the baby?
Yes, that is something else they said, is that one of the benefits of getting the vaccine is that those antibodies will be transferred and will give the babies protection for some time, especially as you're nursing them. So the baby will need to get vaccinated themselves eventually, but for the short term, it will protect them just as any of the antibodies a mother has in their system does get past the baby. That's a great question.
So one more, the effectiveness of both vaccines, are they still the same if you've already got COVID-19 or had it?
Yes. My understanding is that, there's a slight variation in the effectiveness in general, but no, you could get either vaccine and you'll still have the same amount of protection. All right.
Perfect.
So I know we have a lot more questions, and like I said, we can jump into those after the hour, but let's go ahead and finish up for those who need to hop off.
You want to talk about our offer today?
Yes. So as an offer in trying to help you if you have vaccine problems or vaccine questions, Solutionreach is, we want to help you get that communication out there and really help make sure that everything's streamlined. We know you're super busy, and so there is a potential for a lot of chaos for you as things roll out. So absolutely, if you're interested in learning more about some of the things Solutionreach does, please reach out. At the end, there's a survey that we're going to do. And actually for the survey, so fun. Make sure you guys listen. In the survey, there's like 4 or 5 questions. It's super short. But if you fill it out, you get entered in a drawing for AirPods. So I absolutely recommend you do that. But yeah, if you want to hear anything about us, you can get a $50 Amazon gift card just for kind of having a 15-minute demo. We can talk about it. And Sam?
Yeah. This is just a short slide for you guys. If you are interested in offering either the PCR saliva test at your practice or the antibody test, feel free to go to this website listed on the slide, premierdx.com/purchase-covid-test-kits. There's more information there and we can connect that way. So we just wanted to give you that resource.
Okay, awesome. That's so great. I totally recommend. It's such a great way to make a little bit extra money and to keep everybody safe, and it's really easy. So again, you can reach out. Jacqueline, any other comments you want to say before we jump into a few more questions?
No, I think this has been very educational, and let's jump into some more questions. And people are still hanging on for some of those questions, so let's jump right into those before we wrap it up.
You bet.
So this person says, I had the opportunity to get the Pfizer vaccine last week. With the current shortage, she's worried about this, and maybe we've already answered that. Do you know if measures were taken to ensure that the second dose will be available for people like me who have actually had the first dose?
It's like I was saying, I have heard a lot of cases where people were not able to get the second dose on time. However, it won't impact, it will still be just as effective when you get it. However, that being said, there's a couple of things that I see actually in questions here. After the first dose, you're only slightly protected. I think it's about 50%. So just keep that in mind, that if you've only had one dose, it's not like, okay, great, I'm vaccinated now. You're actually still really susceptible to getting the virus. However, if you need to wait and it takes longer than the 21 days or the 28 days, then you should be okay. Oh, one thing I do want to say as well, I have had this question a lot. How long does it take after the second dose for you really to be like immune and protected and all of that? It's 2 weeks. Okay, so again, second dose, you don't go out day 3 and you're protected. It's 2 weeks later before all of the, seroconversion takes place and all of that kind of stuff.
Okay, along those lines, this person received the Moderna vaccine and was diagnosed with COVID-19 about a week later. Should I receive the second dose of the Moderna vaccine?
Like in the same time frame, is that what they're asking? Still continue on?
This person received it on January 6th, got the COVID on January 19th, and it looks like they're scheduled on February 2nd to get the second dose.
Yeah, I believe that you should go ahead and get the second dose. I haven't read anything saying, that's such a good question, but if you get COVID in between the two, they are asking if you've had COVID, like I said, within the 90 days to wait 90 days. However, if you're in the middle of the vaccination process, I think you can continue to go ahead and get it.
Okay, will the vaccine provide protection against the various strains of COVID?
Another good one. I should have brought that up. Okay, so we talked about the virus has been evolving and mutating, and we're getting different strains. I'm sure you've heard of the strain from the UK. There's recently been one from Brazil and Japan. Currently, the strains that are out there, yes, our current vaccine will protect you, as will the testing. Will recognize all of the current strains that are out there. However, If it starts to mutate more times, 2 or 3 or 4 more times, if we start to get a new one, that may be different. But as of right now, all the strains that are out there will be protected through the vaccines and can be detected through our COVID-19 tests that we have.
Okay, so is there a way to choose which type of vaccine people want to receive, or when you sign up, it's like you get what they're offering?
I think when you sign up right now, it's sort of you get what they're offering, you get what you get, and you don't have a fit. However, I think if you have a really specialized reason that you need one or the other, maybe if you looked at those ingredients lists and you did have an allergy to something in one of them or something, I think that at that point you should reach out to your whomever you're getting it from and see if you can request. But generally, they don't take requests.
Good.
Sadly, because I want the Pfizer one, since it says how many fewer side effects, right?
Yeah, no kidding. So why is it recommended for people who've already had the virus to still get the vaccine? Wouldn't the antibodies be the same?
Yes, they would be the same. However, they don't last that long. So 90 days is how long we know they last, which is why they say wait 90 days. But they do eventually stop. Like I was saying, I know multiple people who have now had it twice, and you can continue to get it. You know, if you're at the 90-day mark, you could continue to get it every 90 days. And so because the antibodies don't stay in your system, they peter out, then yeah, you're going to need the vaccine that will keep it. Now, the vaccine itself, you guys, we know lasts about a year. So there is the chance, we don't know yet, they're still looking into it, that there is the chance that the COVID-19 vaccine is going to be like a flu shot that we had to do annually. So that's something to keep in mind. But they don't know yet for sure exactly how long the immunity lasts in the vaccine, but they're thinking about a year right now.
Good to know. So this person said her friend said she lost taste and smell for about 24 hours after the second shot. As you said, those are not side effects, but anyway.
Yeah,
go ahead.
Yeah, I'm sorry. So absolutely, if you lose your taste or smell after you receive one of the shots, that is not a known side effect at all right now. Now, again, they're continuing to follow up as millions of people keep getting the vaccine to get more and more info. But as of today, that is not a side effect of the vaccine. So if you lose your taste and smell, I think it's one of two things. You became paranoid that you'd lose your taste and smell, or you actually have COVID-19. And so if you do lose your taste or smell, absolutely act 100% as if you've got COVID, go in and do your testing, everything else. And it could be maybe in the future they'll discover that that is a really rare side effect, but as of now, they do not have it listed as a side effect.
So this person said if you get COVID-19 and then you get the vaccine in less than 90 days, would this person have the immunity they need? She said her mother-in-law has heart problems. I'm not sure if she should wait the 3 months to get vaccinated.
Gotcha. So we do know that when you have COVID-19, your natural immunities do last 90 days, at least. Some people last longer. Like I said, it really varies. However, if you do have somebody who's health compromised, older, the older you are, typically the less long your vaccination protection lasts. You may want to look into going ahead and getting the vaccine a little bit, or maybe I shouldn't say that, the government would be mad, but I would say if it were my mother-in-law, I might not wait. If she's eligible, I may just take her in and have her get it because she's more high risk. And however, generally you don't need to. You should have enough antibodies in your system to protect you for a full 90 days. You know what I may do is I would set it up so you'd take her in a month before the 90 days are up, so that then she gets her first shot and her second shot's there right at the end of the 90 days. Does that make sense? So as soon as her natural immunity runs out, she already has the new immunity from the vaccine.
Good to know. So regarding the mandatory vaccine, doesn't the federal law only apply if you have 15 or more employees? Are you familiar with that?
Ooh, I'm not sure. I haven't checked in on that. I'd only seen the statement from the EEOC. So I can double check on that and get back to you. But my understanding was it applied to everyone. However, you are totally right. There are some times when you have fewer than 15 employees that things might change.
All right, we've covered most of the questions with all the different, let me see, there's a couple more on high risk.
Okay, great.
past chemo cancer treatment considered a condition that puts you in the 1B group? Are you familiar with that?
Yeah, so it's probably how far in the past the chemo is. I do know cancer, autoimmune diseases, diabetes, which is an autoimmune disease, heart stuff, heart. It's a very strange virus, you guys. So it really impacts our heart, and they are very high risk. So typically, now the 1B group, again, that's going to vary state to state. Everybody has their own sort of little section on when people are allowed. However, you may want to check into how long ago cancer treatment needed to be, how long they've been in remission, and things like that to find out. But typically, yeah, that's going to be a high risk condition.
So many elderly patients ask if they should consider getting vaccinated when it's their turn.
This is one of those great questions that I think you guys should like create a sheet for, that you may start getting questions for, and so that you can give advice. Absolutely. Elderly patients are at far greater risk of if they get COVID-19 than if they get the vaccine. So sometimes it's simply weighing that risk. What are the risks of getting the COVID-19 vaccine compared to actually getting COVID-19? And the risks are far greater. So elderly patients absolutely should be hopping in line. And sadly, literally, it's been so difficult. I've seen big lines of elderly people. We need to get chairs for them or something, waiting for their turn. So yes, if you have elderly patients, 100%. If you have elderly parents, family, 100%, they are at a far greater risk from the virus itself than they are from the vaccination. So definitely go get it.
So this person said her friend was told by her general practitioner that if you're older than 65, the Pfizer vaccine works better and has less reactions. Have you heard about that?
Yeah, so actually the Pfizer vaccine for everyone works a little bit better and has less reactions. So it is true. And if you're older than 65, I think that's just going to be amplified. Again, the Pfizer vaccine does just work a little bit better with fewer reactions, sadly. But both work great, and it's fine. I'm sure many of you have had the Moderna. It's very close.
So have you heard about being allergic to like CT scan dye, sulfa?
Yeah, so I would need to go back and look at the list of ingredients, but make sure when you get the PDF of this presentation, you click on that link that shows for both Pfizer and Moderna what the ingredients are in it. If any of those, if sulfa's in one of those, then yes, you would have complications. So if you've been severely allergic to any specific chemical or something in the past, you need to be checking the ingredients list before you get the vaccine.
So, all right, with the vaccine being paid for by federal government, or taxpayers, how can private enterprise make money with administering vaccines?
Okay, so you would still get paid for it. You'll just either get paid. So what happens is if the customer or if the patient has insurance, you actually bill the insurance and the insurance pays it. If, however, the person does not have insurance, then the federal government will cover it. However, the way they cover it is they pay you. So if you're doing the, administering tests or administering vaccinations, that money that they would send would come to you. That's one of actually the great ways that it's, to me, a good revenue builder, because of the fact that the patients don't have to pay anything, right? So it's not like a sell trying to get them to come in and do it. If you can offer the vaccine, let's say you're in California right now and you already have the ability to offer the vaccine, I would say get on it. Let your patients who are in the eligible group know, we are offering the vaccine here at Jones's Dental. Come on down and we can get that done for you. That is way easier than going down to the health department or something like that. So yeah, and you'll just get reimbursed that way.
Great. What about the mandatory reporting when administering the vaccine?
I guess I'm not sure what the question is surrounding it. I would definitely, if you're looking into administering the vaccine, each state's going to have some programs. So we'll walk you through what you need to do in terms of reporting, in terms of filing for reimbursements, all of that kind of stuff. So you'll be able to get that information from your state. One other thing I did want to cover before we go is the fact that this is what's called an mRNA vaccine. Okay, I've seen a lot of questions about that and what that means exactly. The mRNA is a super safe vaccine. This is something else that's really important to know. What it does is it, instead of actually like using the live virus, although there are some vaccines coming out with the live virus in them as well, the mRNA takes it and it kind of builds like a system of proteins that will trigger an immune response that would create an immunity to COVID-19. And so, you know, most vaccines use just sort of a weakened or inactive version of that disease, and this doesn't even use any part of COVID-19 in it. They've just found a way to be able to stimulate our immune response and create antibodies without even putting the vaccine in our bodies. Is that not amazing? It's like science for the win. They're super smart. So just so you know, if you feel scared, you say, oh no, mRNA, what does that mean? And is this new? And it's actually super safe and really effective.
That's awesome. Do you know if the office antibody test requires a blood draw?
Sam, are you still there, Sam?
Good question. Yes, office antibody tests do require a blood draw. They use like a little lancet, kind of like you'd use, you know, to take blood sugar or something if you're diabetic. So it's a little lancet, and then you use a pipette and place that onto the test kit. So it's just a small little finger prick.
Kind of like a finger prick. So yeah, little finger prick there in the office to get the antibody test. That'd be super fun. So anything else that anybody wants to cover before we go? I know we've ran you way over time. Please feel free, if you have more questions, I am always happy to answer them. If I don't know the answer, I can direct you to people who do. I do see some questions here about kind of credentials and where the information came from. Everything in this presentation is from either the FDA, the CDC, or specific studies put out by organizations. It's not like stuff from the news, or I'm very careful about all of my sources, all of the information that I study. So if you want any of the further research on where this information came from, absolutely reach out to me and I'm happy to send you the studies and whatnot.